Okay, so I'm Ricky. I'm going to be going over uh, an issue that we have coming particularly worrisome for areas that have never had to deal with these kind of specific disease processes. So, vector-borne diseases specifically are diseases that are contracted or transferred by vectors or disease-carrying organisms. So, historically, it's been ticks, rats, birds, and mosquitoes. And what happens is due to cultural, social, geographic, uh, and economic reasons, these vectors can get concentrated in a certain area and become very well suited to live in those areas. So we see that with malaria. Um, those vectors get suited very well to live in those areas, and then due to cultural and social ecological issues, they become endemic to those regions. So the Aedes aegypti is a species of mosquito. Originally was famous for yellow fever and dengue fever. Um, they're a famous vector for carrying flaviviruses, they're a class of arbovirus. They're incredibly small viruses and they replicate really fast, which makes them well suited for being transmitted by small arthropods like mosquitoes and ticks. So other flaviviruses are dengue fever, Japanese encephalitis, yellow fever, West Nile virus, and Zika virus. These are all ones that you've most likely heard of in the past. So, mosquito-borne diseases, specifically Zika virus, has been predominantly limited to equatorial regions. The equator is right here-ish. Um, due to the warmth and lower altitudes. Um, so these are really warm areas where the mosquitoes are heavily populated. So what is changing? As the global temperatures increase due to the changing climate, the zones in which these mosquitoes see, like we used to see them heavily populated around the equator, right? But because it's getting warmer both north and south of the equator, that warm region is spreading. We're seeing these mosquitoes migrating north and south. So we have lots of reported cases of Zika virus in Brazil. Um, India is having a big issue with them currently as well. Um, so with the reported cases increasing, the World Health Organization has set up a monthly reporting log for new cases. So these reports are increasing more and more as the vectors move farther north and south, and so we're seeing countries that have never been exposed to these viruses are reporting cases, and they're attempting to set up new protocols, but when you have populations that haven't been exposed to these disease processes, the data just isn't there to really prepare really well for it. So the World Health Organization has reported so far 48 new countries reporting these cases as far north as Amsterdam. And we even have cases in the United States. We have Miami has a few Zika hotspots identified. And so we are seeing it spread into the United States. And it's just going to keep coming farther and farther north and farther south. So the prognosis for Zika virus specifically, there's not a ton of data thus far, as I was saying, because the cases just aren't that numerous historically. I mean, we understand what the basic signs and symptoms are, but as far as looking at how compounding factors play in, what happens to a person with a heart murmur that contracts Zika virus, like these are the kinds of things that there's just not a ton of data on. So it's often compared to dengue fever, but there's some important distinctions between the two that can both make it a gentler process, some would say, but also it can help clinicians differentiate between the two disease processes, whereas, a lot of times it might get diagnosed as something different. So, as far as signs and symptoms, most of the time, statistically, I mean, as many as 4 out of 5 people present no symptoms at all, which can kind of be scary when you see later on transmission factors. But in the symptoms that do present, we see rashes, especially in the trunk and torso region, fever, generalized joint and muscle pain, headaches, especially notable pain behind the eyes. Conjunctivitis is one of the symptoms that we see that's specific to Zika virus. The rest of these are, ooh, not that one. The rest of these top ones are Zika or dengue fever. These are going to be specific to Zika virus and help a clinician diagnose specifically Zika virus. Conjunctivitis is a big one. That's pink eye, if you didn't know, often gets called conjunctivitis. But really what it is just any inflammation of the conjunctiva, or the white part of the eyes. And unlike dengue fever, there's no hemorrhagic manifestations, no clotting issues, no bleeding issues like you would see with dengue fever. So it is milder in that sense. So as I was saying, most people won't actually get sick enough to even seek medical care. But the biggest cause for concern with Zika virus is pregnant women. So there's a huge risk of birth defects as the virus gets transmitted to the baby. So we've seen cases of microcephaly where the baby's brain and head are underdeveloped. There's cases of stillbirth, Guillain-Barré syndrome, and other birth defects and abnormalities. There's just more study needs to be done on this. And unlike dengue, Zika virus has been proven to be sexually transmitted, with active virus still in semen as many as 2 weeks after the infection has cleared. So as far as prognosis, like I said, there's just so much more study that needs to be done. But looking at the viral load and how it actually works, for a typical healthy adult, the outcomes are usually pretty fair. If symptoms are even present, they usually last several days, up to a week. The virus has an incubation period of 10 days, so you add those 10 days where you can still be transmitting, plus the period of time where you're actually sick, and then up to 2 weeks after where you can still transmit the disease to somebody else. And then lethality studies still need to be done. There's just not enough data to know what the morbidity rate is for Zika virus. I mean, there's just not a ton of cases where it would be with something like malaria. So, like I said, many of the factors that compound the virus with humans just have not had the studies done. So what is the problem? In response to a changing climate, countries and regions that have never been exposed to Zika virus on a scale like this now face a future in which it's not really a question of if, it's when. These are problems we will see. The pattern of warming, as it gets warmer farther north and farther south of the equator, these things are going to start migrating, and we've already seen it. So what can we do? As a healthcare provider, it can seem pretty daunting because I've never seen a patient come in with Zika virus, and I don't know a lot of people who have. It does provide a new challenge, but it also kind of makes denying this problem overall kind of silly. So education is going to be key for solving this issue, or trying to at least get out in front of it. Communicating with each other, addressing the issue, teaching the topic, and arming people with the knowledge to protect themselves. There's been a lot of studies on vectors, specifically mosquitoes, and how to prevent the transmission of these vector-borne pathogens. So there's one two-stage study done in Kenya. It was specifically on malaria, but the fundamentals of protecting from mosquitoes is the same. And I will post all the citations for this study in the end of the video. So this study specifically showed that there was a large difference in prevention and protection from these pathogens between the wealthy parts of Kenya and the poor. It wasn't that people didn't know what they needed to do to defend themselves, it was that they just physically couldn't or they couldn't monetarily afford it. So, taking this into account, I was thinking that a good approach might be to show a best case method of prevention and like the minimum requirements that you can do to protect yourself. So, if we know how mosquitoes live and breed and feed, I mean, most kids know that mosquitoes suck your blood. Um, but knowing how they actually breed, clearing any standing water from around your house. If you see a bucket of water, dump it out. Making places for mosquitoes to uh, propagate and make more of themselves and spread the virus, especially within heavily populated areas, is going to be key. Knowing your area, knowing where you are and how to protect yourself if this is an issue that's already affecting you. Obviously, if you live in Miami, for example, you know or you should know what regions have been designated hotspots and wear clothing that covers as much of your skin as possible. Protect each other, keep your eyes open. All the same things apply. There's evidence for success with a bunch of different mosquito deterrents. Citronella candles, traps, nets are hugely effective because they're not super pricey, they're not chemicals, and they keep mosquitoes out. But not a lot of people are going to want to sleep with nets over their bed. Um, if you can make sure that all the screens in your house are sealed and can keep bugs out, and just be aware of what's changing environmentally in your area. So, I mean, we could look at this two ways. We could say, well, okay, Zika virus seems pretty mild compared to malaria and dengue fever and Japanese encephalitis. And that could be true. There's not a ton of study going into all the intricacies that can happen with Zika virus and other disease processes. So sure, we can call it milder. But just the very fact that the climate is changing to a point to where these mosquitoes can migrate out of their regions and start spreading these diseases into new regions that have never had to see them. It's Zika virus now, but remember, this is the same species of mosquito that carried yellow virus and dengue fever. Um, so if Zika virus can come farther north and farther south out of their endemic regions, then so can dengue fever, so can yellow fever, so can Japanese encephalitis. So these are problems that aren't going to go away. And we need to arm ourselves with the knowledge to protect ourselves and each other. So the time for denying that these changes are happening is over. It's time now to stay in touch with the changes around you and protect yourselves and your loved ones. The migration of these vectors with their environment expanding is directly tied to climate change. Whether you choose to think that humans aren't causing it or you go with what science has shown, virus does not care what you personally believe. It doesn't, nor does the mosquito. So the best thing you can do is inform yourself and protect yourself and make sure that you understand what's changing around your area and how to protect your family, your loved ones, and yourself. So here's all the resources that I used to put this together, and thank you for your attention.